Welcome to Pepper's Nursing Corner, your go-to place for NCLEX-PN practice questions and nursing tips. Let's make studying simple and stress-free. Get ready, your first question is coming up. Which nursing intervention would help to make a successful referral process for a client recovering from a stroke who has been referred to rehabilitative care? Select all that apply. A. Make the referral after the client is discharged. B. Select a suitable rehabilitation center for the client. C. Explain the need for referral to the client and family. D. Provide the referral with adequate client information. Or E. Determine what the referral recommends for client care. The correct answer is C. Explain the need for referral to the client and family. D. Provide the referral with adequate client information. And E. Determine what the referral recommends for client care. Which asset of the nurse as a licensed healthcare professional helps in planning effective nursing care? Select all that apply. A. Critical thinking. B. Diagnostic reasoning. C. Ability to synthesize information. D. Establishment of assessment system for the organization. Or E. Communication of competency requirements. The answer is A. Critical thinking, B. Diagnostic reasoning, and C. Ability to synthesize information. Which instruction related to the use of incentive spirometers is important for the nurse to teach the surgical patient? Select all that apply. A. You should perform 10 breaths every 2 hours. B. Keep the incentive spirometer on the bedside stand. C. Practice controlled coughing after using the incentive spirometry. D. Exhale deeply into the mouthpiece. E. Inhale with shallow breaths if you are having a surgical incision pain. The correct answers are B. Keep the incentive spirometer on the bedside stand, and C. Practice controlled coughing after using the incentive spirometry. The process of obtaining an informed consent for a surgical procedure includes which action? A. The nurse discusses the risks and benefits of the surgery with the patient. B. The witness signs the consent form to verify the patient understands the surgical procedure. C. Any member of the surgeon's staff may obtain the patient's informed consent for surgery. D. The patient's spouse may provide the consent in an emergency if the patient is unable to do so. The correct answer is D. The patient's spouse may provide the consent in an emergency if the patient is unable to do so. An immobile client has developed skin breakdown on the hip. What extrinsic factors may have contributed to the skin impairment? Select all that apply. A. Medications. B. Immobilization. C. Malnutrition. D. Hypothermia. Or E. Radiation. The correct answer is B. Immobilization, D. Hypothermia, and E. Radiation. A client has come to the healthcare clinic complaining of pain in his left arm after an injury, which describes the characteristics of nociceptive pain. Select all that apply. Nociceptive pain can be referred pain. B. Nociceptive pain may be localized to the area of injury. C. Nociceptive pain includes transduction, transmission, perception, and modulation. D. Nociceptive pain develops after an injury to the central nervous system. E. Nociceptive pain is categorized as being either somatic or visceral pain. The correct answer is A. Nociceptive pain can be referred pain. B. Nociceptive pain may be localized to the area of injury. C. Nociceptive pain includes transduction, transmission, perception, and modulation. And E. Nociceptive pain is categorized as being either somatic or visceral pain. The nurse suspects the client will require surgical management of a urinary tract stone. Which of the following circumstances is an indication for surgical management of the stone? A. The stone is in the bladder. B. The client has experienced renal colic. C. The stone is less than 4 millimeters in diameter. D. The stone is associated with a severe infection. The correct answer is D. The stone is associated with a severe infection. The nurse receives report on a client with damage to the part of the brain called Broca's area. The nurse knows this client will likely be having problems with which of the following? A. Talking to people. B. Distal extremity sensation. C. Speech comprehension. E. Controlling voice volume. The correct answer is A. Talking to people. A nurse is caring for a client who recently had an NG tube placed. Before starting the first internal feeding, the nurse wants to check for proper placement. Which of the following techniques is most appropriate to confirm placement? A. Ask the client to open his mouth and check the back of the throat. B. Draw back a small amount of gastric fluid and test the pH. D. Inject 10 ml of air into the tube while auscultating over the abdomen. Or E. Inject 10 ml of normal saline into the tube and listen over the chest. The correct answer is B. Draw back a small amount of gastric fluid and test the pH. A client who had an indwelling catheter has developed a urinary tract infection that has spread to the kidneys. The nurse should include which of the following information as part of her teaching? A. The client should restrict fluids until the infection has cleared. B. The client will need to confirm the diagnosis with urine testing, kidney X-ray, and avoiding cystoscopy. C. The client will need surgery for removal of infected tissue. Or D. The client can continue to recover with antibiotics at home. The correct answer is D. The client can continue to recover with antibiotics at home. Hey, we're all done for this episode. Keep studying and you've got this.